So today we did see a poster presentation from H3 Bio's oral Circa. So this is a selective estrogen receptor covalent antagonist. So similar to SERDs, but it doesn't have a downgrader function. It binds and is a permanent binder. And what we saw is really great activity among patients that were very heavily pretreated with metastatic hormone receptor-positive breast cancer. These patients, over 65% of them, had had at least 3 priors in the metastatic setting, and what we saw is a median progression-free survival of over 7 months, which is quite impressive in the phase 1 setting. It seems to be quite well tolerated. We don't get as much GI disturbance as we've seen with some of the other SERDs. We do see some sinus bradycardia, but that's been asymptomatic thus far. Ultimately, how I think this is going to affect patients is that we're continuing to look at this. We're heading into expansion in phase 2, enrolling more patients and seeing what activity we may see in patients that are even less heavily pretreated. Hopefully this is a drug that we can use both in the post-CDK4/6 inhibitor setting, and I think many companies are also thinking about how SERDs and SERCAs may impact us in combination with CDK4/6 earlier line or even in the adjuvant setting. So we saw overall survival data from Mona Lisa 7. This was a trial for premenopausal and perimenopausal women. They received ovarian suppression in combination with either an aromatase inhibitor or tamoxifen endocrine therapy, and then were randomized to receive ribociclib or placebo. And what we saw, this was the first time we've seen overall survival data in the first line setting, and it was positive. So essentially, at 3.5 years of follow-up, we increased the proportion of patients that were alive from 45% to 70%. So really, this is a quarter of patients, additional patients being alive because of this drug. I think this is really going to motivate people to be using CDK4/6, possibly even first line as opposed to second line, and is really revolutionary for these women.